Dr. Rima, can you give your colleagues a lecture about differential diagnosis between pulmonary and mediastinal masses? Be ready for this, tomorrow morning at 8 a.m.
Hi colleagues, with you in this lecture Dr. Rima. My talk today is about the differential diagnosis between mediastinal masses and lung masses. In case of mediastinal mass, the angle between the mass and pleura is obtuse with indistinct borders with mediastinum. In addition, there will be mediastinal widening and mediastinal structures displacement. While in case of lung mass, the angle between it and pleura is in the form of acute angle with distinct margins surrounded with lung parenchyma. First of all, we must know how we can differentiate between pulmonary and mediastinal mass. Look to the angle between mass and pleural border near mediastinum. If this angle is acute, the lesion will be pulmonary mass. But if the mass is obtuse, it will be mediastinal in origin. The second sign which can help us to make differentiation between posterior and anterior mediastinal masses is cervico-thoracic sign. It is taken from posterior anterior chest X-ray. Look to the area above the clavicle. If the mass is reaching above the clavicle, it will be of posterior mediastinal origin, but if it does not reach above clavicle, it will be anterior mediastinal mass. Another sign we can use it to differentiate between mediastinal compartment, which is Hilar overlay sign. Look to vessels inside the mass. Is it seen or not? If it is visible, it will be anterior or posterior mass. But if it is not visible, it will be in the middle mediastinal space. Now we will discuss the differential diagnosis of different mediastinal masses. Let us first make that for anterior mediastinum, where we have 4 differential diagnoses including thyroid masses, thymoma masses, teratoma and terrible lymphoma. In case of middle mediastinal masses, it could be bronchogenic cyst, hiatus hernia, enlarged lymph nodes or vascular, which could be from aorta as aneurysm or dissection, or it could be from pulmonary artery as in case of aneurysm or embolism. Lastly, the posterior mediastinal masses, which are neurogenic tumors, paraspinal abscess, extramedullary hematopoiesis or paravertebral masses. Do not forget the main sign for differentiation, which is CT density. If the density is fat, diagnosis is teratoma, while if it is fluid, diagnosis is cyst. Finally, if it is soft tissue enhancement, it will be lymphoma or thymoma.